for being here. Staff, thank you for being here. Conferees, thank you for being here. We appreciate it. Welcome to the most exciting committee in the State House again. So anyway, with that, I'll open the recommendations for the Department of Children and Families. And so do I have any recommendations? Representative Howerton.
I have a couple of
and hold on just a second. I might, Representative Howell, are you online? Not yet. Okay. She may be struggling with that. Let me know when she comes in. Representative Howell is replacing Representative Lind for today. So, and Representative Lind, are you online?
Yes, Mr. Chair, I'm here.
Very good. Welcome to committee. How's the weather up there?
It's warming up, but it's a lot of snow.
Really? Very good. Yeah, we're supposed to get some here tonight, so. Okay, very good, committee. Recommendations for the Department of Children and Families. Representative Howerton.
Mr. Chair, I have a couple. Do you want me to do one at a time and then give opportunity for other people to do them and come back, or both at the same time? Okay. Okay. So I like to, we heard from Safe Families for Children yesterday, and just want to recap that, you know, they are a licensed child placement agency under DCF, and they currently have a grant, but I would like to recommend that we approve them for an additional $500,000 of SGF to be allocated to them. For the
second.
Okay, thank
you. Second by Representative Donahoe. Discussion? Representative Ballard.
Oh, I'm looking for my notes and I can't have them. I think that's one that they're funded through DCF. Is that for $250,000 or $299 or whatever that figure was?
They do have a grant through DCF.
It's $299. I can't remember. So left it on my desk. So they have that grant. So and that grant carries over. Am I correct?
That's.
And so I'm just making sure. I think that grant carries over, and then you're adding additional $500,000.
Correct.
Representative Clifford.
Chairman, and I would point out their ask was $2.9 million when we heard from Tammy Thomas yesterday, and I certainly was not in favor of that, but I could be supportive of this additional $500,000.
And yesterday she also asked, her bottom line dollar was 1.6. So, but so anyway, you have a question? Oh, okay. Further discussion on Safe Families. Representative Vaughn.
Thank you, Mr. Chair. I would just recommend that if this motion is approved, we also consider a similar action as we took last year, where we request that the Safe Families in a year's time share some of their statistics and their outcomes with us as a committee so that we can evaluate the success of that investment and so that we can see those outcomes. So if this is the appropriate time, I would make that recommendation in addition to the motion. Thank you.
Is that okay with the maker of?
I think it's a great idea. I actually had that written down, forgot to say it. Thank you.
Further discussion committee. Representative Ruiz.
Sorry, my brain wasn't quite working. Can you repeat your recommendation? I didn't hear it all in my head.
Okay, so I recommend that an additional $500,000 of SGF be allocated to Safe Families for Children, in addition to the grant that they've already been approved for through DCF. And it would be for the purpose of expanding their program in the Kansas City and Wichita metro areas, as well as Southeast Kansas for fiscal year 2023.
I'm trying to find the amount for the grant that they currently have. $299,000 is what they have now. Yeah.
Be 299, is that what you said?
Committee, further discussion.
I'm
Representative Reeves.
sorry, I'm not in favor of that amount of money. However, if the committee approves it, I second with Representative Vaughn that they should be able to give us a report very much the way we've had other agencies do, to see how the money's being allocated.
I think that's been amended into her recommendation.
Thank you.
Representative
I
Ballard.
would say that's really not unusual, because I would hope that with the almost 300,000 that they get from DCF, they have to do something for that to be continuous, that they're funding it. So for whatever reason that they're still funding, we should get that information so that we know our money was used.
And she did mention yesterday that they are filing quarterly reports with DCF.
So you see, I knew that was being done, because if you have that grant, you have to be doing something to get that grant again or keep that grant, so it's fine.
Very good. Further discussion. All in favor, say aye.
Aye.
Opposed, same sign. Motion carries. Further recommendations for the Department of Children and Families. Representative Helmer.
Yes, Mr. Chairman, I have a recommendation to add $450,000 all SGF to recruit, retain, and train for the CALM bonus social workers and CALM super parents for fiscal year 2023.
Committee, I have a motion, second by Representative Ballard. Discussion? Seeing none. All in favor, say aye.
Aye.
Opposed, same sign. Motion carries. Further recommendations for Department of Children. Representative Clifford.
Mr. Chairman, thank you. Since we're on COM's budget or allowance, I would recommend adding $1 million all SGF to conduct a pilot program they recommended to support children with complex needs for the fiscal 2023 budget.
I have a motion. Do I have a second?
Oh, right.
Second by Representative Ruiz. Discussion. So is that in addition to the $450,000 that we just approved?
Yes, that's correct. That's for the separate pilot program for the children with complex needs. So that is an addition.
Very good.
Children with complex needs.
Committee questions or discussion? Representative Ruiz.
I seconded that recommendation. This is one of the few organizations that I have seen that have the infrastructure capable of really developing this kind of a pilot program. They already have the infrastructure. They've got the professionals that they need, and they're already serving, children that have complex needs. And I'm in favor. I think that they can really do this. These are the kids that are often kind of left behind or not, fall within the cracks, so to speak, because the needs are so complex. It will take a lot of training for the super parents and the what they call the bonus social workers that'll be working with the children. But I think they're going to do a great job with it, and I'm very anxious to hear a report from them.
Committee, further discussion. Representative Helmer.
I'm going to go along with that because they stated that they were willing to work in areas that are not covered, especially in southeast and southwest parts of Kansas that we don't have covered. So I really agree with that. Thank you.
The only thing that I would say, and I don't know one way or the other, is if they're capable, they asked for the 450,000 for the pilot program. They didn't ask for more money than that. And it's not a big deal to me. I just want to make sure that they can implement the program and the money's not just sitting there for a year. I know, you've heard me question about, how long it takes to get ramped up. And that would be my only concern about that, is just the fact that without having an input from them, whether they could or not, if they could ramp that program up to utilize the money that we've authorized. And that would be my only concern whatsoever. So, Representative Vaughn.
Wanted to clarify that really quick. So the 450,000, was that for the pilot program? I made a note that they were interested in adding 15 licensed homes and filling in some gaps in funding. She mentioned like mileage and things like that. Was that the 450,000 and the $1 million was a different allocation, or?
The 450,000 was all student, state general fund to recruit, retain, and train the bonus social workers and the super parents. That's what they wanted the money for in 23.
So,
It wasn't the pilot program.
Mr. Chair, if I may, to provide clarification, the pilot program, is that what were kind of what was the recommended program that money would be used for? Was that a study of the?
I had in my notes that they had a $2 million ask for additional funds.
That's,
I'm not aware of that, but we could look back on yesterday's testimony.
I don't see it, but when we look, I looked through to see what they were asking, and it was the 450 because it was italicized, and what I quoted was exactly what they said they wanted to recruit, train, retain for 23. I did not see the pilot program. I'm in agreement with it, but I didn't see children with complex needs. I saw there was a thing she worked with, but I didn't see that 1 million. But we don't always see it when we recommend it either. So.
Well, and I'm looking at the project outcomes. The funding pilot project would renovate traditional plan with over 20 years ago to modernize and meet the seeking funding for 450,000 to recruit, retain, and train bonus social workers and calm super parents. That's in their testimony. I didn't see any more mention of another pilot program. Is what?
Mr. Chairman, I mean, it's in the written testimony as the last paragraph, and again, my notes had a $2 million ask there. I don't know if we can have someone verify that who's in the room. I don't want to do that mistakenly.
Sharday, do you have their testimony there? Is there any mention of?
Mr. Chair, in their written testimony, it says 450,000, but I would have to go back and listen to yesterday's verbal testimony to clarify the 2 million request or 1 million request.
I'm just almost positive that she read off of this deal here. And again, I don't have any problem with that other than just the fact that, how are they going to be able to utilize that or not? That's my major concern. Representative Clifford.
Yeah, I just agree with my colleague, Representative Ruiz, that this seems to be a robust organization with the toughest hires already done, and I think they're quite capable. I think they're ready to serve a need that is not served.
How about if we amend it to get confirmation from them that they can actually use the money? Would that?
Sure, I'll accept that as a friendly amendment.
Yeah, I mean, I just, that's my concern, not anything else, but I just don't want to ask for $1 million and then, have it sitting there and have not been able to use it. I know just, we live in this workforce problems that we're having. Can they hire staff? Can they expand? Can they use it? So that would be a friendly amendment to that we check with them about what they could use, if that's all right with the maker of the recommendation.
Yeah, I'll agree if one of my colleagues would second.
I will second that.
Who originally seconded that? Well,
Go ahead.
okay, you're okay with that. Okay, very good. Committee, further discussion. Sade, do you have your marching orders on that one? Okay, very good. Seeing no more discussion, all in favor say aye.
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 Oppose? Oppose, same sign. Motion carries. Okay, very good. Further recommendations for the Department of Children and Families. Representative Howerton.
And just on a personal, Representative Howell is online now,
Oh, very good.
so you know. So my recommendation is, okay, it's to add language requiring that the monthly rate for the, hold on, let me get the wording correct on that. I apologize. This is 3:30. If you want to go to someone else, I'll pull that up. I thought I had it here.
Committee, further Representative Clifford.
Thank you, Mr. Chairman. I would like to add language requiring DCF to provide the Cerebral Palsy Research Foundation of Kansas with $125,000 from existing resources for the purpose of purchasing and providing durable medical equipment for individuals with disabilities in the state of Kansas for fiscal year 2023.
Very good. Do I have a second? Second by Representative Ballard. Discussion?
I have a question. We're adding that amount of money, but also they were interested in a proviso. Not just the money. They were interested in the proviso because they said that it's a continuous, they get it, but it's not in writing anywhere that it would continue. And they were interested in language that would do that.
Correct. They already have the $125,000 in the budget. This wouldn't be adding to that.
And I'm sorry, I don't have the email I sent in, but I sent in a request for the proviso.
Mm-hmm. And I think, again, the money's still already there. So it's okay to contain the $125,000. We want to make sure that we're not going to duplicate that. So if you're all right with that, we're good.
And yes, I'm fine with $125,000, but I'd like us to provide a proviso so they would be identified as the organization to provide the durable medical equipment to these individuals.
Very good.
Well, I'm in favor of that one because that was one of my recommendations. And I asked him for the clarification yesterday, was that what he wanted? And he said, yes, he wants the language. In fact, I made a joke about it as far as from the law thing. If it's not written, it doesn't happen, and he wanted to make sure. So could we ask Sade to just look at what the writing or have someone draft it so that we are doing what he wants?
Okay. Further discussion?
Just an apology, Chairman, that I'm a year behind on this budgeting process, so
It's okay.
glad to be here now.
You're behind.
You're doing
ahead right
fine.
now.
You're not doing fine. You're doing fine. Further discussion? All in favor, say aye. Aye. Opposed, same sign. Motion carries. Further recommendations for the Department of Children and Families.
Okay, I'm ready.
Okay. Representative Howerton.
So this is concerning the independent living subsidy for foster care youth program. It was in the slides that they presented. I'd like to add language requiring that the monthly rate go back to the $350 instead of continuing at the $700 once the Chaffee pandemic funds are expended. So I want them to continue to use the pandemic funds, but when those are exhausted, we don't continue funding at that rate. We go back to the normal rate.
Do I have a second?
Yes.
Second by Representative Ballard. Discussion? Just for clarification, it was raised during the pandemic.
That is my understanding according to the slides. Yes,
And so then you want to take it back to the pre-pandemic level.
correct. Yeah. Not reduce it, just take it back to the normal levels that we're used to paying.
Further discussion?
I second it so we could discuss it. Why would you like it to go back?
My concern is just the amount of money that the federal government has invested in all these programs, how we are going to continue at that rate.
Well, I think when we do that, when we look at that federal dollars, you know, you sort of know that it's temporary until that money runs out.
And her recommendation in the slides was to stay at that level.
Or at that high level.
At that high level, once the funds are exhausted, she wanted us to stay at that 700.
So your amendment again is repeat your amendment again.
To go ahead and allow them to, I don't know if we'd allow them to, but they get to use the pandemic funds until they're completely exhausted. But then the state does not continue to pay at the pandemic levels. We would go back to the normal rate of the $350.
That's reasonable.
Committee further discussion? All in favor say aye.
Aye.
Opposed, same sign. Motion carries. Committee further recommendations for Department of Children and Families.
When we listen to, oh my goodness gracious, when I'm looking at this, was it Alliance? The Alliance, I can't remember now because it's not written on this one here, because I think it was Alliance, wasn't it? Okay, it was Alliance. Remember, Children's Alliance indicated that I'm drawing a complete blank. That was one that they received 3.7 million that's already in the governor's budget. But if you remember, she were asking 10 million and then 10 million along those lines. But also, if I understand correctly, they have applied for Spark money as well. So my amendment, basically, I'm going to do it in reverse, that the agency should request this funding through the appropriate Spark advisory panel, and this funding should be allocated only from SGF if Spark funding is not allocated. So what I'm recommending is that we would add 5 million, because her priority was, when I asked her, was for the workforce recruitment and retention incentives for child placing agencies and licensed residential facilities, including qualified residential treatment programs. That was the PRTF that we were discussing. But we would only add the 5 million if they did not receive the Spark money.
Who seconded that? Representative Helmer. Further discussion? Representative Clifford.
I'd like to ask if these individuals are already eligible for the governor's extra salary boost for workforce.
Well, with the Spark money, they have a committee that's looking at it and will do the appropriations. And anyone can apply for these funds. And so we have a whole list of people that will be applying for Spark money.
But if you're talking about the 24/7 pay plan, they're not eligible for that. They're not. Representative Reeves.
I'm looking at the testimony, and the 3.7, it's 3.6 from SGF, and that's going to target increasing the protection specialist salary, so the CPS workers, basically. And I've, in the recent week and a half, I've received emails and phone calls from constituents who work doing, they're with Child Protective Services, and they feel like there's like a crisis going on. There are people that are, workers that are leaving jobs and going to other places. Some are going to work for the MCOs, and, you know, and there's other places, of course, that can attract them with more money, and it feels like to me like a snowball effect is happening right now. I've seen this before when I've worked in community mental health centers. Once one or two people start leaving, other people say, well, maybe I need to get out too, and it feels like to me that that's what we're seeing. So I commend the governor for being able to put the 3.7 and target that. This additional 10 million is to enhance that budget for 10 million. It's a one-time lump sum emergency workforce recruitment and retention. I was hoping for 7 million, but I can go with the, I think 7 million is better than the 5 million. Excuse me, Representative Ballard. I know 10 million is a lot. We've got to do something to just stop the snowball effect that's going on. So I would ask if we can change it to 7 million versus the 5.
I don't have any qualms with going 7 million. I just chose 5 as, because they already had the 3 point that was already in their budget. And if we had looked at what they were asking, she was asking an additional 20 million. And so I know we couldn't go that far, because even though we have money and we have one-time monies pretty much, I wanted to be able to do something. But if we can add 5 million, 2 more million, actually, I know it sounds awful, is not going to make that much difference. I mean, in terms of our budget, but in terms of what they're able to do, they may be able to do as much. But in budgeting, I think most of you know when I do this, I stay somewhat on the conservative side to make sure that we can fund as many people that are making requests as possible. And we don't always have the money to meet those needs. So I was being a little bit more on the conservative side because there may be other needs out there that we could help out. So I am not opposed to it. And if we were going to vote on it, I probably would vote for it.
Representative Howerton.
So, thank you, Mr. Chair. Just for clarification, this 5 million or 7 million that we're talking about is going to employees right now? Is that what, workers?
Ma'am, if you remember, I asked her if she was looking at the 10 millions, which would she prefer? And she said she would have her preference for training and doing different things. But if she asked her staff and people that work for her, they would say workforce recruitment. So I went with workforce recruitment and retention incentives for child placing agencies and licensed residential facilities, and including qualified residential treatment programs. That was for our teens and residential living accommodations. So that's how she would be spending those funds. Does that answer your question?
Any further discussion?
Just so not surprising anyone, you lose me at the 7 million.
What's that?
I can't support 7 million, but just
I
would
was
not be surprised on the vote.
Just going to urge caution, and although, you know, if we had unlimited funds, we would do their whole ask. But I think there are other needs, as Representative Ballard has pointed out up there, and I think we just have to be cautious. One thing I might add, Representative Ballard, that was if they didn't attain Sparks, is that right?
Yes, because it says the agency should request this funding through the appropriate Spark advisory panel, and this funding should be allocated, this 5 million, if Spark funding is not allocated, so that they're not out, cannot expand and do the kinds of things that they
Very
want.
good. Okay. Further discussion? All in favor for 5 million?
5 million.
Okay. All in favor, say aye.
Aye.
Opposed, same sign. Motion carries. Further, okay. Committee, with that, you get up pretty early, Rachel. I was in the office this morning and I didn't have, and yesterday I wanted her Sparks proposal for the Alliance. And I texted her and I was very surprised to get an answer back at 6:15 or 6:45 or so. But anyway, what I had told her that we would do, and I and Charday have had a conversation about this, that we will weigh in with a recommendation that says that this committee, this is my recommendation, I guess, that we weigh in with this committee with a letter from this committee that strongly recommends their Sparks requests. And that's my motion.
Second it.
Second by Representative Bowers. Discussion. I think this is kind of what we're going to do matter of fact, the next budget has $245 million worth of Sparks requests. I'm not sure we'll weigh in on all that, but anyway, we will weigh in on these and see if we can add some weight to the Sparks request. So that's my motion. Further discussion? Okay, all in favor say aye.
Aye.
Opposed, same sign. Motion carries. Any further recommendations for the Department of Children and Families? Okay, very good. Thank you, committee. I will now open the hearing. Representative Howell, thank you for being here. Welcome. You could have done remote. We would have been fine.
That happens sometimes.
Oh, well, Representative Howard said you were online. Oh, okay. No. Okay. So we have one more cleanup. I would make a motion that we approve the budget for the Department of Children and Families for 22 and 23 as amended. Representative Reeves seconds it. Discussion? All in favor say aye.
Aye.
Opposed, same sign. Motion carries. Thank you for reminding me of that, Matt.
May I make a comment on that?
You may.
I'll just make a comment. Chairman Carpenter and I are on appropriations, and all of these that we're doing, we present to the full body. And after observing what's been going on this week, we're going to get drilled, and we have to be able to answer all of these things that they throw at us. So I learned a long time ago, my father was an auditor, that you always go on the conservative side, and yet you get a little bit more than you think you really want. But we have to be able to justify everything that we have done here. And we support it to the best of our ability to stick with what you have said you would really like to have. And sometimes they change it. Sometimes they'll put it off into omnibus and not deal with it at that time. And then sometimes it just goes right through. But we never know which it's going to be. But thank you so much. But I want you to know that if it doesn't all happen, it's not because we're not in there fighting for it, okay?
And I will tell you, there has been a few times when I said that I would not fight for that recommendation, just in full disclosure.
Yes.
Because.
And then he'll say, Barbara, you do it.
But there's just some things aren't going to fly if they're that too large. But, okay, very good. Committee, I'm going to open the hearing for Department of Aging and Disability Services. And first up, we have Matthew Moore, Legislative Research. Matt, thank you very much for being here.
Thank you, Mr. Chair, members of the committee. Matthew Moore, Legislative Research. Just wanted to provide you a brief overview of the budget for the Kansas Department for Aging and Disability Services, also referred to as KDADS. You should, before you have a copy of my budget analysis, the page number at the bottom is 1096 in case you have your books with you. So KDADS is the organization that is sort of charged, or the agency charged with providing oversight for social services for individuals with disabilities and aging. They oversee the Hcbs waivers. They oversee programs like the Older American Acts program, as well as the Senior Care Act. As we've heard last week, they have kind of general oversight over the 4 state hospitals. And you'll see some of that kind of mixture of all of those today throughout my presentation. Starting on page 1097, there at the top, last year the legislature approved a budget of $2.3 billion, including $873.9 million from the state general fund. Subsequently to that, the agency did receive approximately $64.3 million SGF in reappropriated funds that were unspent in 21 that reappropriated into 22. These were primarily related with Medicaid-related expenditures that were anticipated through the Human Services caseloads that ultimately didn't occur, so those funds reappropriated, as well as a few programs that were delayed just due to some timing for when contracts were executed. You can see there at the middle of 1097 that the agency requests a revised estimate of $2.4 billion, including $894.7 million SGF for FY22. This is a decrease of $6.9 million. Included in that revised estimate are sort of continued COVID-19 pandemic funds. If you look at that box there in the middle, figure 2, you can see there's a sliver of a green line in that bar graph that represents COVID-19 funds. And originally last year, the agency, we had anticipated that those funds would only be expended in 21. However, they have received some more COVID funds, and so there's an increase just as the pandemic continued and more funds were provided. Additionally, there is the 10% increase related to the Fmap for Hcbs services. You received a sort of a briefing by Amy Penrod a few weeks ago, kind of the agency's plan to reinvest those savings for the direct care work group. As well as there's some delayed implementation of programs from 21 that kind of rolled over into 22. Really the two I'd like to highlight are going to be the beds for the psychiatric beds in Hayes. You might recall that was appropriated in, I believe, the 2020 session, and it's sort of been delayed. My understanding is the agency's executed its contract with KVC, and those beds are planned to be opened approximately in 2023. Additionally, there at the top of 1098, you can see that there's a little blurb there about the remodel of the Biddle building. You've heard about that as well, particularly last week with the mental health hospitals. That was appropriated again, I believe, in the 2020 session, but partly due to the pandemic, that project has been delayed over several years. And due to that, there's also a revised request of $1.7 million for costs associated with increased labor, increased supplies to complete that. But my understanding, as you heard last week, is part of that remodel for B2 will open here this next month, with the East Biddle building starting in March and hopefully being opened in September of 23. There on 1098, you can see in the middle, the governor recommends $2.3 billion, including $830.7 million SGF for expenditures in 22. This is a decrease of 78.1 million below the agency's revised estimate. The primary contributor to that decrease is a kind of revised Human Services caseloads estimate. I believe Megan gave you a sort of an overview of caseloads at the very beginning of session. Primarily deals with KDHE, but KDADS does have a hand in consensus human services caseloads, primarily due to a lower than anticipated Medicaid population. There was an estimated 8.9 89.7 million SGFs that's included in the governor's recommendation. That second bullet there is the governor's 24/7 pay plan. You heard about that last week when we had the briefings for the state hospitals. As indicated, the agency has oversight over the hospitals. So for these items where it affects all 4 hospitals, traditionally KDAD sort of receives those funds and then would distribute it to the hospitals. And I would note for 22, those funds are being paid, those expenditures are being paid with federal ARPA-related funds, so that COVID relief funds are being used to fund those 24/7 pay plan increases. Additionally, the governor included a 2 million SGF for the implementation of crisis intervention centers. I believe you heard a little bit about this maybe last week with the state hospitals presentation. Currently, throughout the state, you might be familiar with crisis stabilization center services. And these are sort of maybe an expansion of that to provide some involuntary services for individuals in the community. There at the bottom of 1098, you can see the start of FY23. The agency requests $2.3 billion, including 903.4 SGF for 23. This is a decrease of approximately 19.4 million below the agency's estimate. Starting on 1099, I would just kind of start to, those first 2 bullets really just sort of demonstrate that what I would call more of a coming out of the pandemic, a sort of return to normal. You see some shifts associated with, the anticipated increases associated with the Fmap returning to normal. You have both that 6.2 temporary increase as well as the Hcbs services 10% increase. That won't necessarily increase SGF expenditures because those are just being reinvested elsewhere, but you're sort of returning back to normal of how things were prior to the pandemic in terms of Hcbs, as well as decreases for COVID-19 pandemic related relief. So again, much like 21 last year, we anticipated 22 wouldn't include, so it's sort of the same thing with 23, aren't anticipating the continuation of those sorts of funds. Additionally, the next 3 bullets are outlining sort of the enhancements, which I plan to go into a little bit more detail here in just a few moments, that are included in the agency's recommendation or request. There at the bottom, you see the governor recommended $2.4 billion, including $970.4 million SGF. This is an increase of $20.4 million, including 67 million SGF above the agency's FY23 request. That first bullet, kind of a continuation of FY 2022 initiatives, primarily going to be that the increase associated with the pay plan. However, what I would note in 23, rather than being paid with ARPA funds, all the funds associated with those, with the 24/7 pay plan is planned to be paid with SGF. Additionally, there at the bottom, you see kind of an expansion of mental health services. Included in the governor's recommendation were several kind of expansions which you heard about, I believe, a little bit last week with the mental health hospitals, primarily more expansion of the crisis intervention centers, as well as some funding for regional beds, as well as some funding for suicide prevention. And then on the top of page 1100 there is also included sort of a shift in funding for mental health expenditures. So historically, there's been a transfer from the State Highway Fund, as well as some funds with the Children's Initiative Fund to provide some mental health expenditures. For FY23, the expenditures themselves still occur, just rather than use the State Highway Fund and the Children's Initiative Fund, those are being used with SGF. And I believe at least on the Children's Initiative Funds, you had received a briefing earlier in the session regarding that. And then there's a kind of a bullet point on sort of the decreases associated with enhancements. I'll go into a little bit more depth there in just a few moments. I will also note that the governor's recommendation does include a transfer of the CanCare ombudsman, which is currently housed in KDADS, moving that to the Department of Administration as part of an executive order earlier to create the Office of Public Advocates inside of the Department of Administration. 1101 is just sort of a 10-year history of the state general fund expenditures as well as kind of the Medicaid expenditures. So you can kind of see where SGF sort of goes down in 2020 associated with that sort of shift in the Fmap, where all of a sudden in the Title 19 funds, you can see that jump occur in 2020 as well. 1102 just begins a little bit more in-depth description of the 22 analysis. 1106 is a little bit more in-depth on the 2023 analysis, but I'll just provide you a little bit of an overview of the supplementals and enhancements starting on 1110. The agency only requested 2 supplementals, so for the FY 2021, that would be the lapse of some of those reappropriations I spoke about earlier, associated with the Medicaid and Human Services consensus caseloads, which the governor included, as well as that additional $1.7 million for funding for the Biddle remodel at Osawatomie. On 1111, you see sort of the gray box with some Medicaid-related requests. These aren't all of the Medicaid-related requests, but the kind of a few that I'd like to highlight: the standardization and increase of personal care assistant services on the waivers. Through several, the past several years, there's been some increases here and there on certain waivers, which the agency found sort of created a discrepancy on the actual reimbursement rates for personal care attendant services. So it created an issue sometimes where an individual might be on the BI waiver, kind of transfer over to the PD waiver, and all of a sudden that person who's providing care to that individual is all of a sudden making less just because they shifted waivers. So included in their request, and then the governor adopted that enhancement, was to standardize those rates all across the board, so all of the waivers have a standard rate, and then a 2% increase as well on top of that. Additionally, the agency requested an enhancement to rebase the PACE rates. So PACE is the program of all-inclusive care for the elderly, very similar to the waivers. They receive medical care as well as some assisted services as well. My understanding is federal rules require those rates to be rebased about every 3 years. This is sort of the year that occurs, and so the agency requested that, and that was adopted by the governor. Additionally, the agency requested some funding to reduce the PD waiver wait list. At the time, there was about 2,200 people on the wait list for the PD waiver. The last estimate I have is about 2142. But this was funding to take people off of that wait list and put them onto the waiver, approximately 350 individuals. But that was not included in the governor's recommendation. The last sort of Medicaid-related item I'd like to touch upon is an increase of assistive services. There, you can see the description on 1112. There's currently a cap on Hcbs waivers, so for assisted services to allow home modifications, vehicle modifications, durable medical equipment. Currently, that cap is at about $7,500, which hasn't been the agency reports increased in about 2 decades, so they had requested some funding to raise that from $75,000 to $10,000, which was included in the governor's recommendation. On page 1113, you see some requests specifically related to the Hcbs IDD waiver, as well as just waiver IDD services in general. The first being an increase in the T1000 specialized nursing code. You might recall last year this committee recommended, and it was approved, a increase in that code for the TA waiver. So this is a code on the waiver to provide sort of specialized nursing care to individuals, similar to maybe the level of care they might receive in a hospital. That was included primarily for the TA waiver. That's where most of the folks who receive that code are on. However, there are a few individuals on the IDD waiver that receive those services as well, and that sort of left a discrepancy that the agency found. Some providers would only provide services to the TA waiver, and so they included a request to raise that rate to $43 to make it in line with the TA waiver. Additionally, you see that they requested some funding for IDD waiver waitlist individuals, very same thing as you saw with the PD waiver. Currently, I think there's about 46,000 individuals, or not 1,000, 4,600 individuals on the, it's a very big difference, 4,600 individuals on the IDD waiver wait list. As you can see, the governor did not recommend that in her recommendation. The last item is sort of an increase in the CDDO administrative funding. So those are organizations that provide services and help with the assessments for individuals on the waiver. The agency sought to increase sort of the administrative allotment that they kind of give to those organizations, but that was not included in the governor's recommendation. The final sort of group of requests I would sort of draw your attention to is on 1115. So these are requests that are sort of related to facilities. You know, we've talked a lot about services to individuals that the agency provides, but the agency does have a arm to oversee the hospitals as well as provide some surveying of adult care facilities. They had requested some funding to increase their survey and credentialing staff. So these are the individuals that go in to survey the facilities, make sure that they're in compliance with state and federal regulations. They had asked for approximately 15 FTEs. The governor came back, only provided about half of that, reduced that to about 7 FTEs. They also asked for some funding in terms of some fingerprint background checks that they're required statutorily to provide. They found that there's a sort of a discrepancy between how much they can charge versus how much it was actually those checks cost. And so they had requested some funding to sort of make up the difference that was not included in the governor's recommendation. Additionally, they asked for an additional FTE for their state hospital commission. My understanding was that was a position to assist with some the implementation of a new performance management system to track employee training at the hospitals. I believe that's currently was provided by DCF, but they are sort of ending that and taking it on themselves. They had originally requested that FTE that did not make it into the governor's recommendation. The last item there is just additional funding for capital projects through the State Institutions Building Fund. You sort of heard about this last week in terms of the rehab and repair at the state hospitals, as well as there were some funds to raise some of the buildings on Osawatomie and one on Parsons. I would note there on page 1116 is just a little bit of a discussion on the Human Services Consensus Caseloads, sort of KDADS is part of that. Really the one thing I would note is in FY23, it included a 3% increase for nursing facility reimbursement rates, as well as the inclusion of all PACE expenditures in human services caseloads. So, you know, in the fall and the spring, we sort of come together with the division of the budget, estimate those entitlement program expenditures. Historically, only PACE medical expenditures were included in that. There were some requests in the last few years to include all expenditures in caseloads, which was included with FY23. So going forward, doesn't increase the amount of funding for PACE, so to speak, right now, just sort of puts it in a different place where we're at, where they show up. The remainder of the budget analysis is really just kind of more program level. So it goes into a little bit more depth on each of the agency's programs. I would just highlight the very last page, 1135, not 1135, sorry, 1137. It's the capital improvements for the state hospitals, which you heard a little bit about last week. The KDAS receives the funding much in the same way that they do with they will with the 24/7 pay plan. They receive the funding for state hospital capital improvements projects, and then provide those projects to the hospitals. I will note that last Thursday, the Joint Building Committee had its hearing and recommendations on the state hospital, and it approved the governor's recommendation for it. And with that, I would stand for any questions.
Committee questions? Representative Clifford.
Mr. Chairman, back on 1098, the Crisis Intervention Center, is that the facility that's going to be stood up July 1st, where in 22 we cut out the implementation money, but we're giving the money to Aswatami for that, or are these multiple facilities?
So, Mr. Chair, members of the committee, I might defer that a little bit more in depth to the agency. My understanding is that these are facilities that are not currently in operation, that the agency's in the process of promulgating regulations and looking to start these facilities, and the funding that's in 2022 and then kind of expanded in 2023 is to help provide services through these intervention centers. But the actual crisis intervention centers themselves are not in existence yet.
Other question, Mr. Chairman? Just so I make sure I didn't misunderstand, on page 1100, do we have there's Office of the Child Advocate. You said Public Advocate. Is there another office I don't know about?
So,
Mr. Chair,
Thank members of the committee, my understanding is within the Department of Administration, there is a Office of Public Advocates, and that would include the long-term care ombudsman, the Office of the Child Advocate, as well as now the Office of the care ombudsman. So it's the Office of Public Advocates is sort of the umbrella term for these smaller offices within it.
Thank you. Thanks, Mr. Chairman.
Representative Lynn.
Thank you, Mr. Chair. My connection's really sketchy, so I hope you can hear me. I just wanted to know, what day will you be doing the recommendations? I'm sorry, I haven't been able to keep up as much as I'd like to.
Monday.
On Monday? Okay.
Uh-huh.
Then if I may ask just a personal question, if Matthew would be willing to meet with me Monday before we go through this, so I can see it. I can connect with him later, but.
Sure, and if you do have any recommendations, certainly relay it to us.
Okay, I should be back on Monday, so hopefully I'll be we have committee, so thank you.
How are you doing?
Me? Sir?
You, yes.
I'm fine, thank you.
All right. Thank you. You're still in our prayers.
I appreciate that. We could use them.
Very good committee. Further questions? Matthew, I just have one. On 1099 at the bottom, in the governor's recommends for 2023, the expansion of mental health services, 19.3 million. Where is that in the budget summary and on the analysis?
So if you look to page 1106, you'll see that more in-depth 23. That's going to be items 16, 17, and 18. And those are there on page 11.
So this 2.8, 15 million, and 1.5. Okay.
Yep.
Very good.
And so those are, I think, 1108 and 1109 are a little bit more in-depth blurbs about them.
And any questions? Just a little clarification. So this 11 and 12, or 11, I guess it is in 10 and 11 are the SGF funding the 24/7 pay plan.
Yes, and so 10 would be that sort of increase for the base salaries, and then 11 is sort of the increases associated with those temporary differentials.
Any further questions? Okay, very good. Thank you. Good job. Secretary Howard, are you up next?
Thank you, Mr. Chairman. Pleasure to be back with you this afternoon. Representative Clifford, just in response to your question, I think you might have been asking about the Crisis Stabilization Center at Parson State Hospital, where a little bit of funding wasn't provided in the current year. But I'll distinguish what the crisis intervention centers are as we talk through the testimony. Yeah. You have our slide deck, and it should also be coming up on the screen in just a moment. I think one of my team is doing that. So again, KDADS, we're a large agency with a lot of diverse functions, but fundamentally our role is really about protecting Kansans, promoting recovery, and supporting self-sufficiency. We have on slide 4 the major program areas of KDADS. Our Long-Term Services and Support Commission, Medicaid Services, Behavioral Health Services, Survey Certification and Credentialing, our State Hospital Commission, the Administration Program, and then, of course, capital improvements are the primary areas you would see in the budget. I'm going to spend just a few minutes talking about each of those commissions, and just give you a few brief highlights of some of the efforts and activities going on in those areas. The first is Long-Term Services and Supports. And this is a new name for a commission that we had been calling the Aging and Community Services Commission. But last fall, we combined that commission with some of our functions relating to nursing facilities, not the survey function, but the program side of that. And so we've renamed that commission the Long-Term Services and Supports Commission. This is a commission led by Amy Penrod. And so this is the commission that's responsible for all of the Hcbs programs that KDADS administers, all 7 Hcbs waivers, everything from the Idd waiver, the largest waiver, to the brain injury, to technology assistance, PD, et cetera, 7 waivers. Also within this commission related to Hcbs, the contracting for the Aging and Disability Resource Centers, the Administrative Case Management Services. Also within this commission are our traditional aging services. Those things really funded primarily through the Federal Older Americans Act and through our aging networks across the state. The Senior Nutrition Program, the PACE program that's already been mentioned. And then also the programmatic side of our nursing facility work and reimbursement. So rate setting, programmatic regulations, and some gatekeeping. When we think about Medicaid at KDADS, we're a large Medicaid agency, even though we're not the state Medicaid agency ourselves. Between nursing home reimbursement, the PACE program, all of the waivers, and all of the Medicaid that's in behavioral health services. So again, a pretty significant piece of our work. On page 7, some of the priorities and issues within our long-term services and supports. And I apologize for those of you who may sit like on the Bethel Committee or some other committees where you may have heard of these things a few times. But I think it's important that all members kind of hear a bit about what's been our focus and continues to be our focus. One of the highest priority areas within this commission has been developing priorities for the 10% Fmap enhancement project. This is enhanced Fmap that's been provided to states under the Hcbs waivers that then the state funds that are saved from that enhanced Fmap have to be reinvested. So a lot of work went into developing a plan over a several-month period. Our plan focuses on workforce, employment, and access to care. It's about $80.3 million that will be distributed across those categories over the next 2 to 3 years. Our highest priority is on the workforce side and some particular recruitment and retention bonuses that will be targeted to direct care workers. And so we're working very actively on that project right now. Also within this commission, some work that's been going on for several years based on some federal requirements is bringing Hcbs settings into compliance with what's called the final rule. In shorthand, the basic bottom line of that has to do with making sure that individuals served in Hcbs settings are accessing that they're as independent as possible within the community. Artificial barriers aren't there to really, being able to live as complete of lives, as integrated of lives in the community as possible. All states have been going through this process. It's a very, very focused process across every single setting that a person lives in the state. We're in the process this year of 2 waiver renewals. Our autism waiver and our SED waiver are up for renewal, and also a number of waiver amendments that also going through the Medicaid process related to the issue of paying family caregivers in some circumstances with some of the workforce challenges that are out there, some telehealth options, and enhancing some of our work around performance measures. We also have some work going on related to the expansion of the PACE program. One of our providers has indicated an interest in expansion of that program. And then I mentioned the budget enhancements here that I'll talk about a bit later. The other piece I noticed last night that wasn't mentioned here that I wanted to mention as well is just a lot of work that's been going on over the course of the last 12 months related to the brain injury waiver. You all very generously supported additional funding to support the demand for the brain injury waiver. That had been a waiver that had been expanded to include not just traumatic brain injury, but acquired brain injury, individuals with strokes, and also expanded to children. And we needed to do some work around ensuring that the waiver kept its rehabilitation nature. So there's been a lot of work going on with stakeholders. There's some different policies and procedures rolling out this month. We'll be beginning to pilot a new assessment. There's issues around how the person starts from the very beginning of the waiver with a transition plan. So I wanted to mention that because I know we spent quite a bit of time on that topic last year. The second commission I wanted to speak about is the Behavioral Health Services Commission. This really includes services around mental health and substance use disorder. And most of the work of this commission is really done through contracts with community agencies like the community mental health centers, like many of the individual substance use disorder agencies, around those services in communities. This commission's led by Andy Brown. A lot of priorities and issues. Those of you in appropriations heard some of those this morning, but I will mention a few that are taking a lot of effort and energy this year. One has to do with the implementation of 988, the new federal number for suicide. We've always had a relationship and contracts with the with the Kansas chapters of the National Suicide Hotlines, but this requires far more comprehensive planning with the implementation of a 988 number. So we stood up a statewide committee, received some federal funding for planning, and developed a comprehensive plan related to expanding the capacity of those contact centers to be able to improve the proportion of those calls that get answered in-state, as well as the work around community-based crisis services. And then part of that had to do then with implementing the $3 million that the legislature approved last year to expand funding to our in-state contact centers. We've also done some work this year to complete a new state suicide prevention plan and launched the Kansas Suicide Prevention Coalition. A significant amount of work related to community integration, particularly as it relates to individuals who reside in nursing facilities for mental health. Another effort coming out of the session last year, you passed legislation that allowed the creation of certified community behavioral health clinics, which really would mean that community mental health centers would agree to provide a very, very robust package of services and begin to be paid in a cost-based manner. I always liken it to a little bit similar to how the federally qualified health centers operate. This is a very, very active work. We're working on draft state plan amendments with CMS, rate establishment, policies and procedures, lots of training. The first CCBHCs will go live in May. We have a number that are under some pilot grant funding from our federal partners, but under the legislation you passed last year, we're just really about 3 months away from full launch. Another project within behavioral health has been to continue our work to contract with community hospitals for alternative beds to our state hospitals. We call those SIA beds, state institutional alternative beds, to reduce, to really give the ability for people to be served closer to home and reduce the demand on admissions to state hospitals. The other thing I would mention here in behavioral health is we did, after a very, very long procurement process, award a contract to KVC hospitals late last fall to open and operate an acute psychiatric hospital for kids in Hayes. And again, you appropriated funding 2 sessions ago for that effort, and we're pleased to finally get that off the ground. It will not open until the beginning of 2023. This will be a modern psychiatric hospital for youth. So there's a lot of remodeling work that the agency has to do, that KVC needs to do to get that operational. But that will be 14 beds serving youth in Western Kansas when that does open. So again, those are really just a few of the things going on within behavioral health. And I'll say a little bit more about crisis services when we get to the budget items. The next commission is Survey Certification and Credentialing. Commissioner Lacey Hunter leads that commission. And this is really the commission that works to protect public health through inspecting and licensing the whole array of adult care homes and providers of disability and behavioral health services. And they've had quite a lift, as I think about over the course of this pandemic, and lots of resilience and nimbleness in needing to respond to different requirements federally in terms of what the focus of those surveys should be, dealing with issues of COVID in facilities, all of those things. So again, that's the focus of this commission. In terms of priorities, this commission is working to finalize those regulations for crisis intervention centers that we'll talk about a bit later. Again, those are, you passed a Crisis Intervention Act a few years ago, and this would allow community-based crisis centers to accept involuntary patients for 72-hour holds in the community. In many cases, some of our existing community-based crisis stabilization centers will expand to take on this function. So again, those regulations are being reviewed by Department of Administration. Then they'll go on to the Attorney General's office and to public comment and be finalized. It's under this commission as well that we manage the issue of nursing facilities in receivership. Many of you know that we had a large number of facilities in receivership for many years. We are down to just one. All of the other facilities have been transferred to new owners, remained open. And then another focus of the commission right now is really focusing on some of the backlog of certification work that was created during the public health emergency when there were federal directives to really focus in really abbreviated ways on surveys. So really wanting to focus on that. There's some other regs that are being worked on or being revised related to residential care facilities, private psychiatric hospitals. This is another area where we struggle on the workforce side to fill vacancies. We have a number of surveyor vacancies that we're continuing to work hard to fill. Again, like so many others with workforce issues. And we're working with the governor's office and other state agencies related to statewide fingerprint-based background check system. And I think the SPARK committee will actually, their modernization committee will actually have a proposal that looks at some issues around fingerprinting and background checks across a number of sectors. All right, the State Hospital Commission. That's a commission that we stood up 3 years ago that didn't exist. It's a very small commission. It just has like 7 staff. But really important, I think, to have some central support to support those state hospitals. And some of the priorities and issues for the State Hospital Commission, front and center over the course of the last 2 years has been all of the work involved to be able to lift the moratorium on voluntary admissions at Osawatomie State Hospital. That happened on January 3rd. Again, due in great part both to some of the work inside the hospital and also the development of the state institution alternatives. Another large area of focus at the state hospitals, and you heard a lot about this during the budget discussion, of course, has been on the pay issues and the 24/7 pay plan, which you'll see reflected in the KDAD's budget related to the state hospitals. A third area of focus has been around the area of promoting community-based competency evaluation and restoration. When individuals are need to be assessed for whether or not they're competent to stand trial, they go to Larned State Hospital, to our state security hospital. And then if they're found not to be competent, Larned State Hospital also provides restoration services within the state security hospital. We have long waiting lists for those services, and over the last couple years, we've been piloting some work around doing some of that work in the community, partnering with courts, sheriffs, other partners to expand that ability. So you'll see funding that I'll talk about in just a minute that Matthew referenced as well that would allow us to expand that work. We also have a substantive bill that will receive a hearing tomorrow afternoon related to community-based evaluation and restoration. And we think it's a really good idea, not just to reduce those waiting lists at Larned, but it keeps individuals in the community. It doesn't have the gaps between the evaluation, the restoration, and when issues might happen in the court. And it won't work, I don't think, for all jurisdictions. For example, some jails just don't have the ability or competency to manage individuals, but particularly in our urban areas, there's a lot of excitement and energy about this. We have a really innovative pilot going on right now in Shawnee County and have actually done competency evaluations in a couple dozen counties. The other thing I would mention on the state hospitals, and again, thank you for supporting this from the revenue side. We are very close as we stand here today to signing a contract for our vendor for electronic health records. We've gone through that entire procurement process. We're very close to signing a contract. And, to sort of bring the state hospitals into the world of electronic health records, as it's so many years overdue when those records came into place in the private sector. So again, thank you for that. We're excited about that, what that means for coordination of care, what that means for efficiency, what that means for communication with community partners. It's very significant. The other programs, I don't necessarily have highlights listed on, but administration and capital improvements. On pages 16 and 17, we highlight COVID funding. And on page 16, on this slide, we really talk about that funding that came to KDADS through the Recovery Office, through the CARES process or the SPARK process. About $82 million came through that process through August of 2021. A huge chunk of that's the funding that very early on went to adult care homes and other community-based providers and nursing facilities. Some funding to behavioral health providers through that process as well. And we, in the current year, we have $9.6 million, and that's really the funding that was recently approved for the first year of the 24/7 pay plan for the remainder of this fiscal year that was approved by the SPARK Committee and the Finance Council a couple of months ago. So that's funding that flowed through the Recovery Office, but we as an agency also, through our federal partners and through very targeted relief, also got some other relief dollars. And you can see those listed on page 17, about $66 million. Not the scale of the child care I talked to you about last week in DCF, where we had several $100 million. But you'll see that funding split out. The largest areas I would mention are really around emergency funding related to mental health to assist individuals impacted by the pandemic. And then towards the bottom of the page, you'll see a couple of lines there that have to do with congregate meals, home delivered meals, some of those more traditional aging services. So again, we have received some of those funds directly as direct awards to KDADS from our federal partners, and we wanted to make sure you were aware of that as well. The next few pages, I won't spend a long time on these at all. Similar to on the DCF budget, just trying to give you a snapshot of our budget. And again, the COVID dollars don't skew it like it did on the DCF chart. So I think, again, in fiscal year 22, about 60% of our funding comes from federal funds, about 36% from state funds, and about 3.4% from fee funds. If you look at expenditures by program, obviously the very largest is going to be what we, within our budget, call our Medicaid program, which really is nursing facilities and Hcbs. And you can see how large that is with behavioral health far below that. Similar things, we also show kind of the SGF by program as well as the federal funds by program. On page 21, I mentioned earlier just what a large Medicaid agency we are. We receive about $1.3 billion in federal Medicaid dollars. So if you think about our total budget is $2.3 billion, $1.3 billion of that is federal Medicaid funds. Again, those very things I talked about, nursing facilities, Hcbs waivers, and behavioral health are the primary areas where you see those dollars. And you can also see on page 22 that the vast majority of the funding at KDADS goes out in aid and assistance. We're not an agency like DCF that has field offices doing eligibility determination, except for our survey staff, which is the largest portion of our staff. Most of what we do is distributing resources to community entities to do the work that they do, community mental health centers, CDDOs, and the like. On page, I'll skip over to page 24, the budget additions in the current year. I just wanted to highlight a couple of those. In terms of supplementals that were recommended, about $13.4 million all funds, $2 million from the State General Fund, 1.7 from SIBF, and I'll talk about those in just a minute on the next page. And then Matthew also talked about the fall consensus caseloads and the adjustments that were made there. But in terms of the supplementals, what you'll see in those supplementals are some additional funding from the SIBF for some added costs related to the Biddle remodel at Osawatomie. This is on page 25. $2 million to begin to fund new capacity in the community for crisis intervention centers, and you'll see a larger amount in the 23 budget. So I'll talk about that a little bit more in the 23 budget. And then the two items related to the 24/7 pay plan that come through the ARPA process and are not general fund in the current year. So you'll see that both the base pay item and the differential item there. So again, those are the supplementals that the governor recommended. Fiscal year 23, again, you don't see a lot of difference when we look at the graphs and charts. A little bit less reliance on federal funds, as we see a little bit, as we see some impact of changes in Fmap and a little less reliance on some COVID dollars. But the general trends of our program stay the same, so I won't spend a lot of time on those charts. And I'll move you over to page 32. The 23 budget additions, the governor's budget included, and we're very grateful, 11 enhancements for the KDAD's budget. About almost $83 million all funds, just under $67 million from the State General Fund. And also the estimates from the fall caseload were funded. And as Matthew said, the fall caseload, I think it is important to note that those numbers do include a 3% increase, 3% rate increase for nursing facilities, and it does include PACE within caseload as this budget committee had recommended. So the budget enhancements on page 33 and 34, we just have we have those depicted in a chart, but I'd like to talk about those by 3 or 4 categories, if we might. So I will move you over to page 35. And the first thing I wanted to talk about are the enhancements related to mental health, what the governor's really called strengthening the mental health safety net, really continuing that work. About $29.3 million total added by the governor. The first item is that the governor's recommending that $2 million supplemental I talked about and a $10 million enhancement in fiscal year 23 for crisis intervention centers. So just some context here. Many of you are familiar with some of the crisis stabilization centers that are in operation across the state. Early ones in Wichita, in Kansas City. We've also had them stand up in one of the most recent ones was in Manhattan, covering multi-county area. Those crisis stabilization centers have been funded by a dedicated source that this legislature supported a number of years ago from the sale of lotto tickets. And up to $8 million from lotto funds is dedicated towards funding crisis stabilization centers and clubhouse programs. Crisis stabilization centers, again, they serve individuals in a mental health crisis, but not anyone who would be in involuntary admission. So again, those are community-based crisis centers that can range from very small, like 8 beds, to large facilities that might have 50 beds. Some of them also do some detox within their facilities or have substance use pieces. We actually have a map within this document towards the back on page 54, just so you get a sense of where the current crisis stabilization services are. Those kind of have the yellow thumbtacks and then where some proposed services are coming. You know, for example, Lawrence will be the next to open. Their building is basically complete on the outside, almost complete on the inside, and will open within the very just next couple of months. And that will be a 32-bed facility that will serve both mental health and substance use disorders. So these crisis stabilization services have been incredibly impactful in terms of allowing individuals in crisis to receive services close to home, stay connected with their families, stay connected with service providers in the community, and really have also had an impact on admissions at state hospitals. What's different about crisis intervention centers is this is a whole new level that would allow involuntary patients to receive those kinds of crisis services in the community. And again, this would allow, you know, like 72-hour holds for individuals on an involuntary basis in a community setting. The governor has recommended a new funding source for this. You know, the LADA revenue has served the stabilization centers very well, but with the ones that we have and the new ones coming, that really wouldn't be sufficient to serve some of the added costs that will be there in serving involuntary patients. So we're grateful for that, and we're also glad that we're close to getting those regs finalized. A number of the existing crisis stabilization centers will likely become crisis intervention centers, Kansas City, Wichita, Lawrence, at least, and there's probably a few others, but those will probably be the first three. Again, so that's the first item when we think about the mental health investments that the governor has recommended. That's the first one, is towards funding those crisis intervention centers, that $10 million in 2023. The second item that I talked about when I was talking about some of the priorities of our Behavioral Health Commission is a $2.8 million state general fund enhancement to allow us to expand our mobile competency work more broadly by expanding our provider pool. You know, we've been using a kind of a private contractor to do some of that work in communities, and again, it's really been more on a pilot basis. This would allow us to include community mental health centers as partners in doing some of that evaluation and restoration work. You know, this is work that's been talked about for a long time. Most recently, the Special Committee on Mental Health Modernization and the Criminal Justice Reform Commission have both recommended the expansion of this. Again, reduce the strain on law enforcement, reduce the strain on hospital emergency rooms. And again, we're excited. We have a hearing this week in the House Judiciary on substantive legislation. So on the mental health side then, so first the $10 million on the Crisis Intervention Act, $2.8 million on competency-based evaluations, and then on page 37, the governor's recommending a $15 million enhancement to build new capacity in terms of regional acute beds. When I've talked about the work we've done to contract with community hospitals under the State Institutional Alternative Program, that didn't add beds. I mean, that meant that if those hospitals had capacity and they wanted to contract with us, people could go to those hospitals instead of to the state hospital. And as we said, on average, we've been serving, 17 individuals there each month. But that didn't really add new capacity. And I think we've all been talking about for a while, do we have enough capacity in the system? So what the governor's recommending is 50 new actual regional beds. That would be split to be 25 new involuntary beds and 25 forensic beds. So again, a 50-bed regional hospital, regional beds. Then the last thing on the mental health safety net, a small item, but I think an important one in conjunction with the development of the state suicide prevention plan, is the governor has recommended $1.5 million that would allow us to provide some small amounts of support to local coalitions to implement their ideas and strategies around suicide prevention. This is separate from 988 and some of that work, which is really about kind of crisis response response. This is really that upfront work around prevention. Those kinds of activities, for example, like some of the neat work that some of the youth did in Johnson County a few years ago, and just to be able to fund some very, very community-based collaborative projects. So we're excited that those resources were recommended. So about $29.3 million related to the mental health safety net. The second set of funding in the budget is around Hcbs. You can see on page 39. And Matthew, I think, did a good job talking about this. The first request we made that the governor recommended was an addition of $23 million, just over $9 million from the State General Fund to standardize the Hcbs personal care services rates, really to align those rates across waivers, really making transitions between waivers easier and not biased by changes in those service rates and not interrupting who that caregiver might be, those sorts of things. And then in addition to standardizing those, a 2% increase was also added to the personal care service rates across the 6 waivers that have PCS as a service. The second item on Hcbs was to increase the IDD waiver nursing rates to $43 an hour to match the rate that you had funded for the TA waiver in the past session. And then the third item, a small item, but I think an important one, is $1.8 million from all funds, $700,000 general fund, to increase the lifetime limit for what we call assistive services. These are things like home modifications, vehicle modifications, those sorts of things that someone might need. There's a lifetime limit. It's been $7,500. This would increase it to $10,000. The $7,500 limit's been in place for at least 2 decades. We know technology has changed, costs have gone up, and anyway, so we're pleased for that modest increase. So again, the mental health safety net, $29.3 million, the Hcbs enhancement funding, and then the other one I would like to talk about is in our survey shop. The governor's recommended funding for 8 new health facility surveyor positions. It's about $600,000 from the State General Fund, really to help with timely performance of routine inspections as well as responding to complaints. This is primarily targeted around our state-only facilities. I think those of you on the Bethel Committee know when you look at some of the charts and graphs we have that although we do very well on our federally licensed facilities, it's very difficult for us to keep up with the surveys for the state licensed facilities. There's about 457 facilities. We currently only have 7 FTE dedicated to that. So again, a small increase there. Couple more things and I'll be finished here. On the state hospital side, we talked about this in their budget, but again, in this budget, you will actually see the dollars for the 24/7 pay plan, with those being state general fund dollars in fiscal year 23, and we would ask for your support for that. And I know it's not in the individual agency budgets, but also for the 5% pay increase for state employees. We then just have, a number of things just for your information. So you can see caseloads across waivers and our various programs, and then some of our performance-based budgeting pieces. And I know Brad Ridley, our Commissioner of Administrative Services, did a presentation for you earlier on those performance-based budgeting. So, and we also just included some maps related to mental health beds attached to this. So I'll stop with that, Mr. Chairman.
Many questions? You're lucky. It's 10 after 5.
I'm always around, though. You know where to find me.
All right. Representative Ballard.
Just a quick one. On 42, when you looked at the enhancements and then you said this was just the governor's recommendation and stuff, there's nothing you're asking us to do on this page, is there? Just information?
Asking you to support the governor's recommendation on the 24/7 pay plan, which shows up in the KDAD's budget. So, yeah. yeah, those dollars weren't in the state hospital budgets, right? Although we talked about it there, because you needed that context for those budgets, so, yeah.
Representative Reeves.
Thank you, Mr. Chair. Secretary Howard, on page 7, or slide 7, you have the long-term services and supports, autism SCD waiver renewals. When are those renewals due, or when are they be worked on, or?
Can I phone a friend for a second? I think I have Commissioner Penrod by WebEx. Can you remind me, Amy, of the timing on those renewals?
Yes, they're set to renew April 1st. They have been submitted to CMS and they are currently being reviewed by CMS. And at this point, we expect them to be to go through the process by April 1st.
By April 1st?
Yes.
Yes. Wonderful. Thank you so much.
Representative Clifford.
Yes, thank you, Mr. Chairman. Secretary Howard, on the CCBHCs, is there a schedule of when each of them will be upgraded?
You know, there is, or at least those that will happen this year, and then we have some indications for the upcoming years. We can provide that to the committee. Yeah.
I guess I'm asking about Compass since I'm from Finn County, but I wouldn't expect it.
Yeah, I just don't recall standing here today, but we'll provide the committee those that are coming on board this year and when we anticipate the others to come on board, and which ones received kind of the federal planning grants too. Thank you.
Yeah, that's what I was going to say. There's a federal planning grant to bring, I think, 5 on this year, if I'm not mistaken.
Yeah, and then a few more got that later on. So yeah. So we'll make sure you know which ones are coming on, like in May, and which ones we would anticipate in the next year. So.
Committee, further questions? Well, I have one, and Matthew's been dealing with it for me, but I'm going to ask personally right here. I want to know about nursing home closings. I've asked for that for the last 2 weeks. I also want to know about how many regional beds we have around the state. And also, I've been asking for a description of the variety of beds that we have. There are, 5 different levels of beds, crisis beds, the whole thing. And I ask that for myself, but I also ask that for the committee so that they understand when you just see beds there, that doesn't mean just beds there. That means there are specific beds for specific reasons. And so I'd like that. And then this morning I was on a Zoom call with a bunch of nursing homes. We talk about the nursing homes. The last time I asked, it was 15 sold and 15 closed, Well, I'm not sure that's accurate. And then I was talking to some folks that had 5 people in their nursing home, so they're almost to close. I just want an accurate picture of the nursing home facilities in our state. It's that simple. And I just have not been able to get the correct information for 6 months, to tell you the truth. But I've been asking for it for a couple of weeks, and we need to drill down on this. Here's the thing, and switching from nursing homes to that, but we're talking about funding for nursing homes. But also, you're asking us to spend money funding a new hospital. We can't do that without inventorying what we now have. And I applaud you, and I've been supportive, and I think Representative Bauer can weigh in here. We've been supportive of these regional beds for a long time because they're so much closer to the folks and they're available for folks so they don't have to travel long distances. But we've got to inventory what we have, what our plan is before we ever start talking about a new hospital. So.
We'll get that for you. We thought we had gone a ways toward that on our testimony this morning, but I think perhaps the chart we had in there, I think maybe it was a little bit too complex. I mean, what I'm hearing you say is, we've got this many beds in state hospitals, we have this many beds in acute hospitals across the state, and what those things are, right?
you
We
could-
have this many crisis stabilization beds, and this is what they do.
Right.
On the kids' side, we have this many acute hospital beds, we have this many PRTFs, this is what a PRTF is. I think that's what I'm hearing you say.
And a
is-
description
yeah.
on a separate
Right.
sheet that lists
Right.
what a PRTF
Yep.
is, what a crisis bed is, what
Yep.
it is, down that line.
Mm-hmm.
And you could even complicate it a little bit more for me. You could put it where they're at,
Right.
if you wanted to do that.
And we have that, because we just recently began to create those maps
Yeah,
that we began
I
to share with
I
you
need
today.
something that I
Okay.
can, if you have to draw it in crayon, go ahead. I
I
can
don't know that we have to do
understand
that, but I think it's really about kind of being able to show the continuum and what each of those elements are in the continuum, what they do, and how many beds there are, and
where they're located.
at. So,
Okay.
yeah.
Very good.
Very
Committee,
good.
further questions? Thank you very much.
Thank you.
Madam Secretary, we are adjourned.